Hey, welcome. This is Dr. Delon Canterbury, CEO and founder of GeriatRx and the Deprescribing Accelerator. So, welcome back to our Red Pill versus Blue Pill series, where we unleash our secret power of deprescribing and wake up our broken healthcare system by choosing the red pill, by choosing the pill of advocacy, by choosing the route of being a disruptor, by changing the way we deliver healthcare. So, welcome back. I'm the founder of the Deprescribing Accelerator. Today, we're talking about how delaying deprescribing in our process flows, in our communities, in frankly everything we do in the geriatric space is adding to the problem of our broken healthcare system, which, as we know, our patients are falling through the cracks with overprescribing, with simply being on way too many meds. There's really no one's fault here. It's not the prescriber's fault. It is unfortunately the healthcare system we're all stuck in. We're all just in this matrix. So I am just trying to be Morpheus, the chief deprescriber, to help us see that we have a deeper role than what our 9 to 5 wants us to do. So, for those who may not know me, I created this program really based on the experiences I had working with patients really throughout my geriatric career. So I've been in geriatric space for about 4 or 5 years, but didn't officially launch my business until 2020 when I was laid off after working for the poison control. So I was like, all right, let's get into the senior care space. Let's start hitting the ground running and seeing what I can do as a pharmacist to serve my community, to reignite that fulfillment, that piece of just joy that I've lost in my pharmacy career for years. But if it wasn't for me going through those down points, back to when I was a pharmacy manager, right? Back when I first started seeing all types of examples of inappropriate prescribing, polypharmacy, hitting my Black patients, my Latino patients, my seniors in Henderson, North Carolina. It solidified that there had to be a better way. And basically, the town had like 2 main primary care doctors, maybe 3. And one of them had just died as I took over as pharmacy manager. So unfortunately, people were getting their care by just going to the local urgent care. And that was the primary care at the time during that transition of providers. And what that showed me, being a geriatric pharmacist, but being in the retail setting, it showed how little we were looking at the way the body works in our seniors and how they respond to medicines. I mean, from basic things like seeing lisinopril and losartan, what the hell? I don't know why ACE and ARBs are inappropriate, but to having multiple older patients on multiple benzos, right? Dilaudid, like multiple antipsychotics, MAOIs that they were on for 30, 40 years, like for narcissism, personality disorder. But this guy's completely confused. I mean, seeing it time and time again, and then not knowing the meds that I thought were okay were actually just as harmful as the ones that we know that are blatantly inappropriate. So from seeing it in retail, but to eventually having our first overmedicated 70-year-old woman who was on 36 meds, where we helped to deprescribe them down to 8, showed me that if I was able to get or find a client who was so overmedicated within the first 3 to 4 months of my business, it solidified that the need for our role as deprescribers is never going away. There's just always someone who's dealing with maneuvering the meds, administration, understanding what they're for. And so I figured, let's create a course that isn't an MTM, isn't a CMR, isn't a MedRec. This is specifically meant to implement deprescribing in our senior patients. Yes, we're using genomics as well, but we're looking for tools that are specific to the elderly, because these guidelines that we, basically use as prescribing habits aren't always looking at senior patients. We're literally using info and data for generally the younger adult population, which is majority male and majority white. And we're extrapolating that to all of our seniors, expecting them to basically have that same side effect profile you see on Lexicon. And it's not always true. And that's what I felt was lacking when I'm doing MTMs. Even when I was doing MTMs in retail, it was like pulling teeth, one, to get someone to trust what I'm even saying to you, because there was no trust. It was like, here's the law, your local pharmacist, I kind of know you, but let me do this forced call to get $7 for a reimbursement for my pharmacy, and later they ended up outsourcing the MTM stuff. But the MTM process is a start, which, for those who don't know, MTM is medication therapy management. It's a start, but deprescribing has taken this a whole new level further. It's like a whole new use of skills that MTMs do not cover. It's specific to deprescribing in our seniors. So that is something I want to make sure is communicated, and that is what I've wrapped into our 12-week course training program. It's a hybrid interactive coaching program for 12 weeks where we will go through essentially 10 live modules, talking through about 10 different, honestly, critical pieces of the geriatric care system in terms of what to look out for in deprescribing, catching common harmful side effects that we may see in geriatric patients, understanding what geriatric syndromes are, having an idea of what the falls risks are and what the assessments are for falls risk, understanding the Beers list, of course, but more importantly, knowing the health conditions enough to know what side effects are to be the most problematic and that lead to the highest hospitalization rates in our seniors. So we're looking at a number of tools to get your deprescribing acumen to the top tier level, right? We all have, honestly, the power to do it. We just aren't truthfully taught it. And in fact, we're doing them in different ways. You mean there are pharmacists who, are health and wellness coaches. So they're implementing lifestyle changes, integrative lifestyle changes as a tool to help deprescribe some of their patients. There are those, again, who work in the dementia space, and they're focusing on reducing falls risk, reducing gait, improving mood and anxiety within a very, very tricky population to treat. So this program is literally a teach back of all the patients I've had since I've gotten my BCGP, but more importantly, since I've started geriatrics and saw really how little I knew until I started doing the research, until I started looking into, honestly, data outside of our country for people that are literally implementing deprescribing and making it sustainable across the world. This is not just something we got to do here. This is something that is in an international problem, and it's the use of prescribing and overprescribing too many meds way too freely. So I created this program to teach what I've learned essentially in the last few years of patient management and deprescribing, but also to get people who are just as passionate about getting their seniors off of these meds on how to do the very same thing, how to not think you need another training, another certificate course, another 4 years of pharmacy school or whatever. You don't need all that. You just need to have a passion, and you need to know some of the tools to help create a system to make deprescribing the norm. That's really it. You need to change policy, and you need to change the way we approach our medication mindset, right? So I promise that people who finish this course and complete our 3 weeks, that they will understand not just how to deprescribe highly within the geriatric space without a board certified geriatric pharmacy credential. I'm not bashing it, but I'm saying you don't need all these credentials to do this type of work. You don't need to be an LTC or a SNF for 15 years to start advocating for your patients to a whole new level of concierge care. That's not necessary. That's why I created this program. Or for people like you who work in those settings, who see our seniors are just not getting the best care and want to make an active difference. So this is for those senior-facing pharmacists, senior-facing nurses, senior-facing organizations that have clinicians and are looking to roll out a new value-based service, people that are looking to future-proof their business, people who are entrepreneurial. This is the course for you. We're going to give you the clinical tools for deprescribing, but you're also going to get the one-on-one coaching with our monthly coaching calls, which is all live and recorded in our private membership portal. You're also going to get a 2-hour VIP implementation and strategy plan. So basically, you and I will dig down into your model, into what you plan on doing with your business and how you want to leverage deprescribing, how you want to tell your deprescribing impact story, how you want to align what you stand for with what brought you into pharmacy, into nursing, into the healthcare space, into senior care. We got to realign that fire because trust me, we got a long slugfest ahead of us. And with an aging population, with less and less and less geriatric care providers, there is opportunity for us to capitalize on, but more importantly, to serve in a capacity that I feel is so unmet. It is so unmet. So I firmly believe all the prescribers out there want to know and implement deprescribing. They just don't have the time. And they rather have someone do it for them than have to waste time in office trying to do this. And it's not a waste of time, but in their eyes, they're not seeing the why. They're not seeing the bottom dollar change that using deprescribing advocates will have on their business. So let's break it down. We're here to save our providers time. We're here to do what's best for our patients. We're here to reduce harm. We're here to reduce potential adverse drug events. And we're, of course, here to reduce hospitalizations and anything that may lead to unnecessary waste of healthcare resources. That's one of our goals. And our goals, of course, is to help you, the deprescriber, achieve that financial freedom, make a name for yourself, get back to serving in the role that you felt our jobs were not letting us do, right? In that capacity, in that 9-to-5 role. All the things you want to do, I want you to get comfortable learning how to do that, but particularly serving in our seniors communities, okay? So who is this program for? I mentioned we got entrepreneurial, business-minded nurses and pharmacists, people who already have an idea of how to work on their business or how to run a business and are looking to develop a new revenue stream. This is meant, again, for senior-facing facilities, so adult daycare centers, home health agencies, nursing homes, people who, again, are pharmacists and nurses who have a passion for working and advocating for seniors. Again, senior care facilities, wellness centers, right? Wellness directional centers. These are for people, again, who are looking to make this happen for themselves. This is not for people who are unmotivated with deprescribing, who do not think that there's a problem with overprescribing in not just America, but in our seniors in the entire world. It's just an issue, right? This is not meant for people who are patients or caregivers. This is meant for clinicians. This is meant for healthcare professionals who specifically want to be an entrepreneur or want to roll out a whole new model to grow themselves, grow them brands, and differentiate themselves in the field of senior care. So what does it look like when someone joins our program, right? We have 3 weeks. Each week, we have an hour-and-a-half live webinar where we teach our content live. Everything is recorded in our portal. So if you miss one or two, you'll have access to the recording. So no worries there. We also will have access for you to join our private LinkedIn community group. So all of our past alumni who have been a part of our course can pose their questions, can make any comments, share their wins within our private LinkedIn group for deprescribing as well. You'll also get monthly coaching calls. So there'll be monthly coaching calls where we go through, again, working through your business plan, working through your strategy, and putting in a deprescribing action plan for you and how you want to best show up and serve. Okay. What also happens is you'll have access to, excuse me, yours truly. So any coaching things you need in a moment, the access to community of other alumni who have finished our deprescribing advocacy program. You'll have access to our other past cohort members, and you can ask them questions on their deprescribing journey and how they're using deprescribing within their business and within their current roles. So that's also what you would get, okay? The path really in our program that makes it work are for people who see the business side to deprescribing and the passion to take action. All right. The people who get the most out of our program are those who are fearless, are those who continue to just do without just sitting on their butts and hoping that things will come to them. Right. This does take a bit of tenacity. It takes a bit of fearlessness to get this going for you. So I want you to come in clear-minded that you're not in this to just consume another course. You're not in this to just sit and get your credential. You're in this to start putting into action today. So our first week, I'm giving you challenges to get you serving, to get you in front of your ideal client, and to get you comfortable with telling your deprescribing story, your why, the reason why this is something that matters to you. So we'll be able to pinpoint that and then niche down where you want to start marketing your services. And that's what you will get from our implementation 2-hour VIP road mapping session. So at the end of our cohort, you'll have a 2-hour brainstorming VIP deprescribing implementation session. Essentially, again, where I come in and we talk through and get to the biggest, problem that you want to solve using deprescribing for our seniors. Okay. So you'll also get access to our PowerPoint lectures. You'll get access to downloadable. There's tons and tons of resources. You'll also get a deprescribing toolkit, which is essentially a patient questionnaire to get you thinking open-mindedly about, okay, did we assess if they're on more than a certain amount of meds? Did we look for false risks? Did we check anticholinergic toxicities yet? And the list goes on. So that's a questionnaire that you can use basically today once you join our program. Guess what? You'll also have access to all of our past modules that we've recorded. So we'll be entering our third cohort. And so the last two cohorts, we have all the recordings for them as well. So in case you missed one or want to get a different feel or example of other group dynamics, you'll be more than welcome to check out our vault, which has all of those recordings, in addition to the recordings of our individual coaching sessions, which we cover everything from fear, from mindset shifting, from learning how to market to prescribers, learning how to niche yourself when you're going to business offices, medical offices, understanding verbiage, understanding how to relate and get into the community to start attracting patients for deprescribing clients. We get you comfortable learning how to do thorough deprescribing assessments, okay? So we give you the tools, we walk through the tools, and then we tell you how and when it's best to use them. We also give you top of the line evidence-based recommendations. So everything we teach isn't just Delon's anecdotes, it's all evidence-based. So I provide sources, I give you the tools, I give you the resources to access at your leisure. So nothing I'm hiding. It's all something I want you to have access to and then implement as your progression goes on. Okay. So we talked about basically our 10 weekly live trainings, our implementation strategy session. You will end our course receiving a deprescribing certificate of achievement. So you'll be a certified deprescriber after you complete our cohort. In addition to that, you'll get coaching sessions monthly. You'll also get, and this actually is currently pending, so I'm going to just say that for our call, but we are awaiting some good news. So if we get that good news, I'll make a special announcement about that in the next week or so to sweeten the deal. So I will share with that when that time comes. So the power really is yours. We start our first cohort the week of September 19th. Okay. The deadline to apply is September 16th. So September 16th is the deadline to join. We only take between 5 and 7 people, okay? Because we want to keep it small, we want to keep it intimate, and we want to ensure you're getting high quality with the time that we are dedicating to your growth and growing your business and growing yourself and fighting our fears and keeping us, well, alive, reignited in our passion for deprescribing. So that is what you'll get. Again, we take 5 to 7 people. Enrollment closes on September 16th. So I know those people who are watching, consuming the replay, looking at the content. If you haven't done so, set up your next step suitability call by using the application link in the description. That way, I'll be able to get a better feel for you and see if this is the best fit for you and if it's the best value for you at this time. So we are looking again for people who are committed to meet once weekly for 10 weeks for a total of 12 weeks in our Deprescribing Accelerator programs. The minute you join, you're going to get a road mapping session. You're going to have access to our LinkedIn network. You'll also get our Deprescribing toolkit. You'll get coaching from me, basically knowing the pitfalls I've made in my journey in trying to grow the business and understanding how to solidify my market and how to market and niche to my ideal client. We'll also be sure that this is, again, meant for the clinicians. This is not for patients. This is not for caregivers. This is not for people who aren't open-minded. This is not for people who want to just sit and do nothing. This is for the action takers. This is for the fearless. This is for the bold. This is also for those who may be scared, but just need a little bit of hand-holding along the way. All right? It's taking the leap that matters here the most. So if you are ready, check out the link in our description, set up a next step call, and we will be sure to reserve your seat if you qualify. So hope you guys are doing well. Much love, and I will see you next time for our next series of our Red Pill versus Blue Pill. Join our Deprescribing Accelerator. It is a coaching program that will get you comfortable deprescribing in seniors, and then more importantly, playing an active role in our senior communities as you grow your business. All right, I'm Dr. DeLon. You guys take care, much love, and I'll see you next time.